was fantastic. I had a great time exchanging ideas from the US with Indian innovators, as well as learning a lot from what's happening in the Indian market in transforming healthcare. So I take away a lot of learnings as well, as much as I had things to share from the United States. Well, I think first we'll have to innovate at scale and with speed. So we'll need to not boil the ocean and start quickly and sort of go towards making change happen relatively quickly. The second is we need to rethink the process completely. We can't just digitize inefficiency. We'll need to completely rethink what the future model will need to be. And it's not just moving from paper to pixels. It's rethinking what the workflow has to be and reimagining that in digital. Third is, I think, India is a big country, and one of the things I'm inspired by is how we've solved the problem of patient access at such a different cost proposition than many other countries have. I want to really take that model in how we rethink patient access in the United States, especially as we serve rural communities and underserved communities. So those are the three learnings I have. Yeah. So let me start with what India can learn from US first. One of the great things about the United States is clinical innovation. We've always been the leaders of great products and great innovations when it comes to a new form of surgery, robotic surgery, neurosurgery, pediatric oncology, pediatric cardiology, great medical devices, great pharmaceutical products. How can you create an ecosystem of innovation on the clinical side, leveraging academia and industry and hospitals to work together to make that happen? That's one area. The second is really thinking about the outcomes and quality mindset. It's something that the US has definitely ingrained more than any other country to measure outcomes differently, and how do you connect all of that? That's the second part. The third is there is a lot of new learnings coming about in the US in terms of adopting AI. Obviously, a lot of the more recent generative AI innovations have been pioneered in the US. And that's led to a floodgate of new companies that have been working on generative AI and other solutions, how they can transform healthcare. That's something that, for example, ambient listening is going at scale. So how do you sort of leverage a lot of that? Now let me sort of flip it. I'll keep the total to 5 so I could, in the interest of time. So I gave you 3 ideas of what India can learn from the US. Let me give you 2 ideas on what the US can learn from India. One, the hustle mindset of doing all the right things with a cost mindset as much as outcomes is an area that India is out-innovated. Part of the reason is there is not that much of investments available or capital available to do healthcare at a grand scale as in the United States. And India has really thought about that much more differently and able to do it at a far less cost basis. The second is I really am inspired by this idea of how do you bring UPI-like innovations as India did for payments into the US in terms of driving interoperability and driving a common standard across a fragmented ecosystem of providers, home health companies, retail companies, ambulatory centers, retail centers, urgent cares. There's a fragmented ecosystem even in the US. And how do you drive that interoperability across a lot of those pieces? The EHR still captures only a small portion of the overall data, and even that is not interoperable in the United States. Combine that with all the other sources of data, and I think it's an opportunity for the US to learn from India's UPI innovations in what we've done in the payments ecosystem in India and can be ported into the US.